Thank you, Mr. Chairman. Thank you again for being here, Secretary Burwell. I'm glad you're here to highlight the ways that HHS plans to continue and expand critical investments in health and well-being of the American people. The first step toward reforming our nation's healthcare system has been to improve access to healthcare by ensuring that everyone can obtain affordable healthcare coverage. We know that the Affordable Care Act has made great strides in that goal, and we must continue forward. We must also continue to be forward-looking and take the next steps in healthcare reform. We need to continue to make strides toward ensuring that everyone has access to the right care at the right time at the right price. I believe that there's great potential in the power of technology to help us achieve our goals of healthcare delivery system reform. Electronic health records can improve providers' ability to coordinate care, and technology such as face-to-face video between providers and patients and technology that allows providers to remotely monitor a patient's chronic conditions can increase access to needed care, improve patients' outcomes, and reduce costs. I was very pleased that this year's budget expands the ability of Medicare Advantage plans to deliver services via telehealth and enables rural health clinics and federally qualified health centers to qualify as originating telehealth sites under Medicare. Secretary Burwell, I am pleased with this progress, but I think there is still much more we can do. Can you talk a little bit about the inclusion of telehealth in the budget and any other proposals that HHS is currently considering in this space?
So we think that telemedicine and telehealth is an important part of getting access. We've talked about access, and certainly in rural communities and other communities, this is going to be an important tool. And we've taken two, as you articulated, very specific steps in our budget because we think Medicare Advantage should pay, and because part of the reason that the field is not developing as much is because people don't get paid. So if you don't pay for the ability to do these services, and that's part of the Medicare Advantage. The other part is finding the facilities that will meet qualifications so you do it in an appropriate and safe way. And that's the proposal that you mentioned, and it's related to HRSA and our federally qualified health centers. We know that these health centers are serving literally millions and millions of Americans across the country, and most people actually have some in their district, and so that idea that you can use them as a base. The other thing that we are working on right now is, and it gets to Mr. Pallone raised in his earlier comments, the issues of IHS, Indian Health Service. And right now we are suffering from a very serious problem on our reservations in terms of youth suicide. And in order to get providers in places like Pine Ridge, it's very, very difficult. And so we are using our ability to actually use telemedicine as a means by which we can quickly get providers, because when you have these suicides, making sure those children have the support they need, other children, is a very, very difficult thing to do quickly.
Yeah.
Because we can't get the providers to go. And so while we're working on permanent solutions, these may become the permanent solutions because they're stable. Providers come and go, but the telemedicine providers, we think, will be in a place where they're going to provide more care for a longer term.
Well, thank you very much, and I look forward to continuing work with you on these issues. It's our shared goal to ensure that Americans have the ability to access the right care at the right time. And we must work hard to achieve that goal for the whole person, which includes access to mental health care. One of the goals of the delivery system reform is increased care coordination and behavioral health integration. We must ensure that people have access to a full spectrum of mental health services and that those services are integrated into medical care and coordinated across different providers. I believe that the Excellence in Mental Health Demonstration Project, which I co-authored with my colleague, Congressman Lance, has the potential to reform our nation's mental health system by improving access to community-based care and by integrating and coordinating that care across different provider types. Secretary Burwell, thank you for including in the budget an expansion of this demonstration project to 6 more states. The more we can test out this model, the better chance we have of finding out what works so we can expand it to those who so desperately need a better system of mental health care. Would you like to comment further on HHS's work on this project and its potential?
Yes, we think it's a very important part of our work in terms of getting this integration and getting it quickly and doing it in a way that we can both get integrated care and also move towards where people are paying for value, not volume, in terms of getting the right payment to providers. And I think you know that with your all's help and support, we've beat the statutory deadlines with regard to the implementation, and then we have added to that by the proposal in the budget, which we hope will be viewed favorably.
Well, thank you very much.